morning, ma'am. So now, I'm going to assess the mouth, the nose, the throat, and the sinuses of the patient. So before we go to the procedure, we're going to introduce ourselves to the patient. Good morning, ma'am. I'm Anjit Piguba, and I will be your student nurse for today. So I will be the one who will assess you on assessing your mouth, your nose, your throat, and sinuses. So for verification po, ma'am, may I ask your name, date of birth, and age?
I am Andrea Piacapoba. I'm 18 years of age and I was born on June 17, 2003.
After that is we're going to explain the procedure or the purpose of what we are going to do. So, ang purpose po nito, ma'am, ay para malaman natin if there are any abnormalities na pwede natin ma-observe or makita sa assessment. So, after we explain the purpose of what we are going to do is we're going to provide the patient's privacy. So, if the door is open, we're going to close it. Let's just pretend that it's still open. So also if the curtain and window is open, we're going to close it. So after that is we're going to perform a hand hygiene. So after that is we're going to collect the subjective data. So, ma'am, I just have a few questions to ask about your health history. So, I hope you can cooperate with me po. So, do you have any mouth problems po?
Wala naman po.
Wala naman po. Tongue or mouth sores or lesions?
Wala.
Gum or mouth redness?
Wala.
Is there any swelling, bleeding or pain? Do you also have a sinus problem? Pain over sinuses? Post-nasal drip?
Wala.
Okay po. Do you have a nose problems po? Like
No.
nosebleeds,
No.
stuffy nose,
No.
cannot breathe through one or both nostrils? Lahat naman po nagpa-function? Okay naman po yung paghinga nyo? Okay po. So, change in ability to smell or taste? Do you have previous problems with your mouth,
Wala
throat,
po.
nose, or sinuses?
Wala po.
Wala ka naman pong naranasan dating surgeries or treatment?
Wala po.
Use of nasal sprays? Wala naman po.
Wala po.
History of tooth grinding?
Wala.
Last dental exam? So, what is your daily practice of oral care po?
So, nag-toothbrush po ako everyday.
Okay po. So, usual diet?
Sa usual diet ko po, ang ginagawa ko is nagbabawas ako ng kanin and umiinom ako ng maraming tubig,
Okay po.
vitamins.
Okay. So, nag-smoke ka po?
No.
Or any use of tobacco? Hindi naman po.
No.
So, umiinom ka po?
No.
Okay. So, we are done in collecting the subjective data. So, the next thing that we're going to do is we're going to collect the objective data or the physical assessment on how to assess the mouth, the throat, the nose, and the sinuses of the patient. So now, I'm going to collect the objective data or we're going to demonstrate on how to get the physical assessment or the assessing of the mouth, the nose, the throat, and the sinuses of the patient. So after that, we're going to gather all the equipment that we will be needing. So I have here a gloves, a cotton gauze pad, a tongue depressor, and the pen light. So let's just pretend that this is a pen light because I don't have a pen light. So after that is again we're going to explain the procedure to the patient. So ma'am, ang purpose po nito is para po malaman natin if there are any abnormalities na ma-observe natin on your assessment. So next, we're going to the procedure. So the first thing that I'm going to do is I'm going to assess the nose and the sinuses. So when assessing the nose, we're going to inspect both external and internal of the nose. So in checking of external, so ma'am, allow me to touch you po. So in checking the externals, we're going to palpate the nose of the patient. So ma'am, wala naman po kayong na-feel na masakit or
Wala.
pain? So ma'am, can you please do this po? Then breathe in and out, inhale, exhale. Again, the other side naman po. Inhale, exhale. So ma'am, is there any difficulty in breathing po? Wala naman po.
Wala.
Normal naman po yung paghinga nyo.
Yeah.
So after that, we're going to inspect the internal nose of the patient. So using a pen lights, we're going to inspect the internal nose of the patient. So it's normal naman. The septum is symmetric. So we're checking the internal nose of the patient if there are any changes in color, both external and internal. If there are any changes in color, the size, and the shape, if there are any swelling, bleeding, tenderness. So after that is we're going to assess the patient's sinuses. So I'm going to palpate the sinuses of the patients for any tenderness. So ma'am, allow me to touch you po. I'm just going to palpate po. Nafe-feel po kayo ma'am na pain o wala naman?
Wala.
So after we palpate the patient's sinuses, we're going to forecast. So there are no tenderness naman. So after we do the percussion, we're going to transilluminate the sinuses for air fluid. So using a pen light, we're going to transilluminate the sinuses of the patient. Magandang po ma'am. So now I'm done with the assessing of the nose and the sinuses, and the next thing that I'm going to inspect is the assessing of the mouth and throat. So first is we're going to assess the mouth. So again, we're going to perform again a hand hygiene. After that, we're going to put a gloves. Next is yung kabila naman. So after we put our gloves, we're going to assess the mouth of the patient. So we're going to assess the lips, the tongue, the teeth, and the gums, and also the buccal mucosa of the patient. So we're going to assess if there are any changes of color, there any swelling, bleeding, or any white patches, and etc. So, can you do this po? So, we're going to check if there are any changes of color in the lips, and also the shape, if it is symmetric po, or if it is normal. So, okay na po ma'am? So, the next thing that I am going to assess is the buccal mucosa. So, I'm going to get the tongue depressor and the pen light. So, ma'am, can you please open your mouth po? So, we're going to check the buccal mucosa if there are any changes of color, also if there are any bleeding, swelling. So now I'm done checking of the buccal mucosa. So the next thing that I'm going to inspect is the teeth. So ma'am, again, can you please open your mouth po? So we're going to check the teeth of the patient both up and down. So now I'm done checking your teeth po. So the next thing I'm going to do is the gums. We're going to inspect the gums. We're going to check the gum of the patient if there are any changes of color, there are redness, bleeding, swelling. So now I'm done. And the next thing is that I'm going to do is we're going to inspect the tongue, the mouth floor of the patient. So ma'am, can you please put your tongue up in the mouth, up in the ground of the mouth? Okay po. So using a tongue depressors, we're going to assess the tongue of the patient. So we're going to check the floor of the patient's mouth. There are any changes of color, redness, there are swelling, or bleeding. So now I'm done assessing of the mouth, and the next thing that I'm going to do is assessing of the throat. So ma'am, can you please open your mouth and say ah?
Ah.
So we're going to use our tongue depressor. We're going to check the uvula of the patient if it is in normal positioning and mobility, and if there are any changes of colors, shape of the uvula, and also the tonsils, if there are no inflammation. So now I'm done on assessing the nose, sinuses, mouth, and throat. So after that, we're going to document all the data that we gather. So ma'am, all in all po, we are already done with your assessment po. So all in all po, wala naman po ako nakita mga abnormal findings. Normal naman po yung lahat. But there are some instances po na napansin lang ako. Like yung sa teeth mo po, yung spacing po medyo hiwalay. But all in all po, normal naman. So after that, we're going to document the data that we gather. If ano ang ating ginawa, if what are the abnormalities that we observe. And next, if meron tayong nakita mga abnormalities, is we're going to diagnose using the PES, the problem, the etiology, and the signs and symptoms. So after that is we're going to again, after care, we're going to gather all the equipment that we've used. So we're going to dispose the gloves that I've used. After care, so we're going to gather all the equipment that we've used. Then that's all.